When you think of gastroenteritis, okay, think of viral, think of bacterial. For here in the United States, viral is the most common. Gastroenteritis in general, you get by consuming something. That makes sense. And the fecal-oral route is by far the most common. Now, you can also have contaminated foods, but often that also is from feces. So feces is the main contaminant in all gastroenteritis. So what we have here on this particular slide are just some electron micrographs of different viral particles. And the most common ones we're going to talk about are noroviruses and rotaviruses. So the signs and symptoms are what you would imagine. It is, abdominal pain, cramping, diarrhea, nausea, vomiting. And so it's the diarrhea that is the most problematic for these worldwide. So the diarrhea can contain up to, for example, trillions and trillions of virions in the feces. And so now with explosiveness, right, that is a way to kind of project out also all these viral particles. And that's why it's so easy to pick up these types of viruses if other people are having vomit and diarrhea. And so the treatment really is oral rehydration. So oral rehydration therapy continues to replenish the electrolytes and the fluids for people that die of certain types of these viruses. For example, in third world countries, they die by diarrhea. It's really sad. So electrolytes and fluids will typically, maintain the course and allow people to come out of the infection, on the other hand, alive. So norovirus is the most common one in the United States. It's prevalent throughout the world. And so if we look here, what we see from the CDC, that, there's 20 million cases every year by noroviruses, and it's a group of viruses. It's not just that there's one norovirus, and that 1 out of every 15 people in the United States contracts this every year, so it's very common. And so, and we have hundreds of deaths every year as well. And so this image is used pretty commonly. Norovirus, you don't want it, and that's telling you right there the 2 modes of dissemination. And if we go back to the earlier parts of the class, right, the vomit, the diarrhea, full of infectious particles, mode of transmission, right? And even if, we'll talk about mode of transmission even more with some specific examples. And so, for example, this isn't recent anymore, but I've decided to leave this particular slide up for from 2014 because this, when I was teaching that particular semester, this was one where there were 2 cruise ships that overlapped in terms of having norovirus just coursing through. And so the problem with cruise ships is that everybody's there. You can't get out. And so if people are having vomit and diarrhea and things aren't being cleaned up with bleach as well as they could be, or soon enough, because the thing about, for example, norovirus is that you can be infectious before you even realize you have it. And even when your signs and symptoms clear up, you can have it for a couple weeks after. Okay, so if you've got it, if you're shedding these viruses in your feces, and your hands are contaminated, and you're touching things, and other people then touch their face, get into their mouth, eat with their hands, then you're transmitting that even more. Okay, so this article right here is part of your assigned reading, this one up here in the corner, so make sure you go to that. The one thing I like about this is that it's in the popular press. It's on Slate.com, and it really gets to the heart of some actual scientific reasoning of why norovirus is such a menace as it says. And so it talks about, for example, cruises, which is very common, a particular football game. And so this is particularly interesting where there was a football team from North Carolina that came and played football down in Florida against a Florida team, and during the game, some of the North Carolina football players started coming down with diarrhea and vomiting from food that they had eaten, I guess, on the way down there. And so some of the Florida players that hadn't eaten any of that, just the contact of the game, they then got sick too. So in other words, the football players on one end, some of them had norovirus, had been having diarrhea and vomiting. They were playing the game, and during the actual contact, they transmitted that to the other team, right? So, and then this concert, I'm going to go ahead and click on this right here because this is particularly interesting. Well, it's all interesting to me, of course. But this, for example, shows, let's go to the table first. what we're seeing is this is a table of illness attacks at primary schools in the UK that attended a lunchtime concert on 27th of January of this year. And what you see is that there were a number of schools that attended, number of pupils, and the percentage of that. So school A, 90 kids came down with it 2 days later. Well, that's the median date. And then 73, 36, so high percentage. And if you look at school A, they were in tiers 12 and 13, which is right here. Okay, so the highest percentage was there. And then if you go down further, that's followed by tiers 9 through 12, 11, and then 3, 7, and 8. So 9 through 12, right? And then 8, tiers 2 and 3, so all up here. So what is going on up there? Well, the day before, the evening before, a man had come down with signs and symptoms and started vomiting in tier 13 up here. He then went to the men's room and continued to vomit. The next day, these kids came and a lot of them got sick. And so clearly, that vomit was not cleaned up enough. The men's room everywhere should have been just bleach, 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 right? And so we know that bleach is particularly important, right? We use it in lab all the time. And so you really need bleach to clean up when people are vomiting from some type of sickness, have diarrhea, because that's where the infectious particles can be. Okay, so these poor kids, think about it. They went to a matinee afternoon to see this concert, and then they contracted this just from handling whatever was there. And then, of course, how did it get into them? Right, eating something, putting them on their face. So anyway, these are particular examples. The reason I wanted to highlight those is that cruise ships are often in the news for it. This football game, just get in contact with people that had this sickness, and then the concert just show you how the modes of transmission and using epidemiology, as we discussed earlier in the course, is used to really understand more about how these infectious agents spread and really how to stop it. Okay, and so if we look down here, the Slate article does a really good job talking about the fact that you only need 10 virus particles, right, to get infected with norovirus. That's such a small amount, right? They live alongside out of the host, so they're naked viruses, right? And we know that what that means is that they have no envelope. And so if you don't have an envelope and you're a virus, that means that you can withstand things like hand sanitizer, right, which has alcohol as its main antimicrobial agent. So these naked viruses, right, like we've seen before, are much more resistant to it. So influenza you can get rid of with alcohol with no problem, but these particular types of viruses, in this case norovirus, much more difficult. And so again, I mentioned before, still contagious up to a couple weeks later, and that means you're shedding the viruses in your feces. Okay, and so there's no vaccine, and up until just a couple years ago, scientists could not grow this. And so now they have succeeded in finding out how to grow this in human cells, which hopefully means that there'll be a vaccine available at some point. I'm making this video in April of 2018. And when I just did a Google News search for norovirus, it's all over the place. There's an outbreak of people that had eaten clams in Spain. Right now up in British Columbia, people that have eaten raw oysters are contracting norovirus. And if you just keep looking down on the news, it's all over the place. And in general, right, so don't fixate on these particular examples, and particularly in cruise ships, because norovirus is the most common type of gastroenteritis in the United States. So it is common. It is your stomach bug, although it's not. It's the stomach flu, although it's not a flu. So rotaviruses, we don't have as heavily a burden of rotaviruses in this country. There's a vaccine for this, and really this is a child killer in third world countries. And if you look at this map, what we see in terms of rotaviral deaths, a big absence of red dots here. It doesn't mean that nobody dies. That's up to 1,000 deaths. But you can see that the underdeveloped countries, that's where the burden is. This is really great news. By the end of 2013, vaccine had been deployed in over 60 countries. And look at the drop here. In 2000, there was on average every year 500,000 children dying from rotavirus. And fast forward to 2013, it dropped down to 200,000. And by and large, vaccines are one of the main reasons why that occurs. So, anytime I look at some type of disease and there's a lot of people dying from it and there's a vaccine available, it's just always one of those things it's really hard to kind of come to terms with as to, why people are still dying from this. So anyway, rotavirus, it still is important in the United States. And so here we see that in the U.S., prior to the vaccine, which was in 2006 in the U.S., almost every child was infected before their 5th birthday, right? So it's kind of a rite of passage for kids in the United States. Not so much anymore, and so this is what we were seeing before that, and now this has dropped to really about 20 to 30,000 hospitalizations a year now that we've got the vaccine. So anyway, those are the two viruses that I wanted to talk about. This is just showing you again that this one also is a naked virus, which is why it's so hard to deal with. So in terms of viral gastroenteritis, really all I want you to know right now is norovirus and rotavirus.